Well, this has been so much fun, and we're going to have a great experience now listening to our keynote speaker. Judith is, where is she? Come on up here with me. She's one of our premier volunteers at this museum, has been here for a long time. My relationship started with her when I did her VHP, and we met each other. And she, after that experience, she jumped into the volunteer family and has been a really big part of everything we do here now. She is a nurse. She was a U.S. Navy veteran. She is a U.S. Navy veteran. She's a Vietnam veteran whose nursing career spanned over 50 years. The last 20 years working with hospice programs as an educator and an expert in quality and compliance. She's a mother of 2 and grandmother of 2. She's lived in Idaho for 18 years. She recently was recognized by the state of Idaho as one of 5 women depicted on the 2020 Silver Medallion honoring women's veterans. Subsequently, she was included in an exhibit at the Idaho State Museum called Trailblazing Women of Idaho. She continues to serve here as a volunteer. We are so happy with her here, and as a part of the group of Vietnam veterans bringing the wall that heals to Meridian this summer. So she's here, by the way, afterwards, if you have any more questions about the wall. Judith will be here to help you. So I'm going to turn this over to this wonderful woman. Let's welcome her to the Warhawk for her talk.
Thank you, and Vietnam veterans, welcome home. The welcome home that we never got. It's a real honor to be here and to be asked to speak to you. And some of my fellow volunteers have heard from me before, so apologies if I'm redundant. I've decided to focus on 1 year out of 5 years of my service in the Navy Nurse Corps, the one that I think people are most interested in, and that was my service in Vietnam. And I'm hoping to share with you some things about that experience that maybe you haven't heard about or maybe you don't know about, and we'll talk about the women and the role of women. We're just working with the technology here. Okay. Here we go. A lot of people don't know that women have served for centuries, and it started in the Crimean War when Florence Nightingale and some of her friends provided nursing care, and after that she founded the nursing profession. So nurses have served in harm's way in every conflict and in every war since then, and I think it's important to remember that, because we hear a story. I heard a story that someone said, well, there were no women in Vietnam. There were no women. And the answer to that was, you must not have been wounded. So that was a good thing, that you didn't see any of those women. So as a matter of fact, they don't even know how many women served in Vietnam. The estimates are between 5,000 and 10,000. And the reason they didn't was because they didn't record gender. They just had a list of names. And so they've been able to, based on the names, figure out somewhere between 5,000 and 10,000 that served there. Not all were nurses, but 95% were. A lot of them, and most of them were Army. The Navy was a relatively small presence, and so most of the nurses that you might meet were Army nurses that served there. But there were other women there too, Red Cross workers, there were regular service, regular Army, regular Navy women who served there. So they served in various capacities, but it's not very well known. I'm not fond of this system. So I want to talk a little bit about the nurses then. It was the youngest group in Vietnam ever sent to war. Army nurses were sent immediately following graduation. They graduated, they took their exams, they became registered nurses, and they were sent to Vietnam after a short training in the U.S. The Navy had a different approach. They sent nurses only after we'd had 2 years of additional training after graduation. Most of the Navy nurses that were sent were even more experienced. They were like lieutenant commanders, they'd served in Korea, and so they had a wealth of experience. And when I was honored to be able to be assigned to the repose, I was one of 2 younger nurses that they decided maybe we had stronger skills, more bedside, clinical skills, and so we were kind of an experiment. And apparently we passed because then they started sending more of the younger nurses. How are we doing? So I served aboard one of the 2 hospital ships, the USS Repose and the USS Sanctuary. Hospital ships are named for words of comfort, and so that's the naming situation. And this hospital ship, in 1968, both of the ships were on station in Vietnam. Each had a capacity of 750 patients. And it's a pretty small ship, and we'll talk about that in a minute. So the ship had 7 decks, was 520 feet long, 71.6 inches at the beam, no armaments, and fully illuminated day and night. Even when these hospital ships were in very treacherous, dangerous places, they never had armaments. And when our patients were brought aboard, if they did have any weapons or anything, those were taken away and locked up and not accessible to anyone. We had part of what we were trying to create was an atmosphere that the soldiers who came to us, and I say soldiers rather than soldiers, sailors, airmen, it's just easier to say soldiers. When they came to us, we wanted them to feel safe, to feel like they were at home, and we tried to create a climate that conducive to that. And so the hospital ship was equipped just like the hospitals at home. In those days, in the 60s, everything was white. We wore starched white cotton uniforms, dresses, and that was intentional. And we approached our chief nurse at one point, a couple of us, and we said, why can't we wear fatigues like the Army nurses? And they said, no, we're doing this on purpose. So then we kind of got with the program, and it was really, really important to always look good and to smell good. I put mascara up there as a reminder, and this was something the Army nurses did too. Made it a point for the benefit of the soldiers, for the benefit of their morale, to look as normal as we could and to look as attractive as we could. And when I attended the ceremony dedicating the Women's Memorial in Washington, D.C., while we were waiting for the ceremony, a lot of different soldiers came up, and they wanted to hug all of us. There were all the nurses that were there, and one of them, he gave me a hug, and he said, "Oh, I remember how good the nurses smelled." He just had a little flashback. So I guess whatever we did was actually working. So we did make it a point to look as good as we could. The service area where the repose and the sanctuary was where the fighting was the worst at the time, which was in I Corps. Actually, it's 1 Corps. Everybody calls that I Corps. And it was from the DMZ south to Chu Lai. And the ships are able to get closer to where the casualties were coming from. So we could be as close as possible. And so we did move. At one point, we admitted 200 patients in 24 hours. 1968 was the worst year in terms of casualties and deaths in the whole Vietnam War. This was the crew, and it's going to be surprising. 750 beds, 29 nurses. Well, the key to that was 256 corpsmen. It was the corpsmen that made such a huge difference. And I learned so much from my corpsmen. They were trained to function independently, and we were trained in the United States as with all the barriers that nurses experience. So there were a lot of things we couldn't do, a lot of things we never learned. But the corpsmen, I remember they taught me how to suture, and normally nurses don't suture, that's left to the physicians. But I learned so much from them, and because of them doing the direct care, that allowed us to function successfully with that small number of nurses. And you can see the chaplains. We had 2 chaplains, a pharmacist, 24 physicians, most of whom were surgeons. And then the whole key was the presence of the corpsmen. How many of you were corpsmen or medics? You got those hands up? Yeah. Well, thank you all. You made all the difference. Much appreciated. We do have in the lower hangar display, it's cabinet 167, and it features a fellow who is captain of the ship. So we had 2 captains, one captain of the ship and one captain of the hospital. We didn't have much to do with the ship's captain. Most of our patients came to us by helicopter. That is not a Huey. Most of them came by Huey, but that's just another helicopter that was landing on the deck of the ship. And those helicopters were landing day and night. I think that may have been bringing the mail. And one time, the helicopter bringing the mail missed the deck, went to the drink. And our first concern was the mail. It was not, you're so dependent, with no email, no phone calls. We were dependent on snail mail, and it was very, very important. I remember writing to people that I had only met once in hopes that they would return the favor. We have to have a shout out to all the Huey pilots. The Huey was originally intended just to be an air ambulance. Later they were called Dust Off because that was their call letters was Dust Off. And they were so successful then that they were armed and they were gunships and they were also used for transport. But because of them, because of those helicopters, we had a very good success rate of survival. If people got to a hospital, we had 98% survival rate. Wow. And it was because of them. And we hear now about the golden hour. We learned about that in Vietnam. If you can get people fast enough, you have the best chance of saving their lives. And so, big shout out. Any Huey pilots or crew chiefs or in the audience? Oh, I see some. These were heroes. They were heroes. That's just kind of a picture of the inside of the helicopter, and I've always told the story of, you know, the Hueys have a distinctive sound, and when you hear it, you always recognize it. And we were having a Vietnam Veterans Recognition Day a few years ago, and we had a Huey flyover. And all the guys, all the vets, Vietnam vets that were part of this, were so excited about the Huey. I was not. I associate that with getting more casualties. Oh no, there's more. And so I really had to understand that to a soldier that means rescue. But to me it means there's more casualties. And I'm still working on it. One of the things that was a challenge and that was you know, a difficult thing to do and to learn about was the kind of way that we did triage. Triage just means sorting, and it's a way of sorting the patients, and you can sort them according to what their needs are, but what we had to sort them for is who we thought had the best chance of surviving, who we had the resources to care for, and how we could distribute those resources to benefit the most in the most ways. And this is a really, it kind of goes against our grain. You know, we're used to the sickest patient gets the most care. I mean, that's what we're accustomed to. That's not how it works in a war, and it's not how it works in a disaster. So this is one of the challenges. Now, we didn't just make things up. I mean, we had a systematic way of looking at the patient and making that determination. And if we didn't think they would survive, they were determined to be expectant, was the word used. And they were taken care of and made comfortable. Nobody was ever left alone. Nobody was ever left to die alone. And this is important. We had a really close relationship with the chaplains. They've served such an important function in many ways, the morale of the crew, but also working with patients who were not going to survive. And that was a challenge. We had 3 operating rooms, and unlike the operating rooms here, I mean, we would have 3 different patients undergoing surgery at the same time in the same operating room, or we'd have somebody operating on their legs and their head and their chest at the same time. So it was a whole different adaptation. You do what you have to do. Now this is how an example of one of the wards. The only way we could have 750 patients is if you have the patients stacked up. And an example I'd like to give is, I looked this up, St. Luke's, the one in Meridian, right off the freeway, I think they have 139 beds. And you think about 750, how could you possibly do that? We sorted the patients according to type of injury or their type of condition so that people with similar needs were in similar areas. Officers were segregated. We had a sick officers' quarters, and regardless of the wounds or whether they had an illness, they were cared for on a separate ward. We did have an intensive care unit, and intensive care units in the 60s were just starting. I know the hospital where I got my clinical experience, we didn't have intensive care. So this was just starting, but we had state-of-the-art, and that we already had an intensive care unit. That's where most of the nurses worked, in the intensive care unit. That wasn't for the corpsmen. We treated everybody who was brought to us. There was no judgment about what branch of the service we're in, or why they were there, and we had an international ward where we took care of Vietnamese women and children. And when there was time, they were given things like corrective surgeries. It didn't happen very often during that year. We had soldiers from other countries. Of course, we had South Vietnam, the regular army. We had South Korea, the ROCs, Korean Marines. They were incredible. Australia, New Zealand, Thailand, and the Philippines. So we treated anybody that came. You can't turn that helicopter away. There probably were some Viet Cong, there were probably some North Vietnamese, but we didn't know it. and so you still treat them. It was an interesting role in that we served all those purposes. We were stand-ins for their mom, their sister, their girlfriend, and did that kind of listening and give the kind of comfort that's not physical comfort, but comfort for what they were experiencing and what they were going through. And I thought about this a lot during COVID, because one of the things that people kept complaining about, they said, the nurses in the hospital said, this is terrible. We can't have visitors. We don't have, the family can't come in. And they had Zoom, at least. But I thought, at the time, well, that's what it's like in a war. You don't have all those people, so you help each other and you support each other. I won't say too much about the shipboard living conditions. You can kind of imagine, but we did work 6 days a week, and we worked 12 hours on and 12 hours off. But if you needed to work more, of course you did. You did whatever was necessary. And I was reading a book about an army nurse in Vietnam, and they had the same kind of a schedule. But some days you didn't have it. Some weeks you didn't have any time off at all. We had to learn to live on a ship. We went to the Philippines a couple times and went through a typhoon. And everything was falling, the ship was geared to tie things down. Everything had to be tied down, and yes, I did get seasick. What kind of wounds did we have? We had 3 times the number of amputations in World War II, and as a matter of fact, World War II and Korea combined. Well, why was that? A lot of that was because of booby traps, landmines, all kinds of explosive things, and also some were not traumatic, but they were because of infections. We had chest wounds, head injuries. I had got a lot of practice in caring for people with burns. Burns from napalm, and phosphorus. And phosphorus is horrible stuff. And some of you corpsmen could probably speak to that too. That you just have to, it keeps burning until you get rid of it. It's awful stuff. Blast injuries, shrapnel, and a lot of injuries and infections in the feet. So if I can get your feet infected, like with these punji sticks and some of the booby traps, I'm going to put that soldier out of commission. They're not going to be able to function, so it's going to, and it affects the morale, but we had a lot of that going on. And the soldiers that get, they called it jungle rot, because their feet were in water, so I'm seeing them, yeah, I know that. And I understand they still have it. And once you've had it, you'll have problems with your feet forever. But it was the enemy's way of taking another soldier out of commission. Some of the medical conditions, I mean, you can have the same things that we would have here. It would add a few. Malaria, a lot of the soldiers didn't take their malaria meds routinely. Maybe they didn't have access, they didn't think about it. What we took at the time was something that you take once a week, but they missed it, and so they got malaria. Skin infections, hepatitis, I mentioned jungle rot, but they could have influenza too, typhoid, rabies, and parasites, and then drug abuse was a problem as well. I talked about the corpsmen a little bit, how essential they were. Every Navy corpsmen are assigned to every Marine unit. Others that were corpsmen were conscientious objectors. They were made corpsmen or medics because they did not want to shoot anybody. but they were in harm's way for sure, in great danger. So they were the first, first responders. 5,000 corpsmen served, 4,500 were awarded the Purple Heart. So if you can take out the corpsmen, that's going to really affect the whole unit. 290 Bronze Stars, 127 Silver Stars, 29 Navy Crosses, and 4 Medal of Honor. And in the Vietnam Wall memorializes the names of 683 hospital corpsmen. They're amazing, as I said. We had to always be ready to accept more patients. And so the idea was get people either back to duty as fast as you could, or prepare to send them, stabilize them so they could go to another hospital, go home. But you always wanted to keep patients moving so that you could have room for more. So we did medevacs periodically. I can't remember exactly how often. It may not have been a regular schedule, but about once a week, I remember. And so we would prepare them. We wanted to put our best foot forward. And so the first medevac I did, I was told, well, make sure that they're in the best, find all the blankets that don't have holes in them, and they had all these blue pajamas, make sure they have the best pajamas. And I said, well, why are you sending away the good stuff? Most of us intuitively, you want to keep the good stuff, right? Get rid of the other stuff. They said, oh no, they represent us, and the way they are received tells the people that receive them what kind of care we give. And so I was embarrassed, ashamed, but learned that great lesson. So everything was, they were just made new, and they were in the best shape they could possibly be. They were waiting on litters out on the deck. They were transported by helicopter to the air base, and then the Air Force took them from there to their final destination. Just some facts for you. Now, younger people don't know who that guy is. I don't know if you remember. And they say he never really said that, just the facts, ma'am. You remember watching him? The hospital mortality rate was 2.6% per thousand, compared to 4.5 in World War II. 98% of those who made it to a hospital survived. Out of 2.7 million who served, more than 300,000 were wounded, and more of half of them were seriously wounded. So, interesting statistic. More than 90,000 were evacuated by Hueys. So, another shout out to the Huey pilots. And I called them heroes. They really were. There were over 7,000 of them deployed. They flew over 7.5 million flight hours, evacuated more than 90,000 patients. 40,000 pilots served, most flying Hueys. 3,000 were lost to combat ops, along with 2,700 pilots, crew, and passengers. And of the 8 nurses on the wall, there are 8 Army nurses on the wall, lost their lives there. 2 of them were on helicopters at the time. So I've always had this, my approach to life is no matter what happens, I have to learn something. And my kids even would say, I know, it's a learning experience. And I always have to find, what can I learn? How can I get something good out of this? And so I learned a lot about pride in work, about how your work represents you, caring for your teammates, worrying about the people that you're working with, and making sure that they have what they need thinking about who's going to be following you all the time, and teamwork. We were all a team. It didn't matter if you were an officer, enlisted, or what your rank was, any of that. We all worked together as a team. And the beauty of this is, it was the first 5 years of my career, but I carried that through the rest of my life. And I think it was one of the most valuable things that I learned. And of course, I learned a lot of new skills, many of which I could not use, because nurses couldn't do those things in the States. And I learned a lot, and it was like proof I'm tough. I can be tough. Coming home, just a few words about that. You would think it would be better. I had prepared. I thought, I'm going to be talking to people. Nurses are going to want to hear about this experience, because I calculated in the Navy, we only had about 300 nurses that ever served in country in Vietnam. And I thought, this is such a unique experience. People are going to want to hear about this. Well, not the case. I quickly learned nobody wanted to hear about it. And it was easy to hide it because nobody suspected us. We weren't, you know, a 19-year-old bilateral amputee. So they couldn't guess it. When nurses who experienced nursing in the war applied for jobs in civilian hospitals, they were turned away. They were told, we'll have to retrain you. They were afraid that we'd exceed our scope of practice. I did work for 1 year. I lasted 1 year in a hospital. It happened to be in California, and the patients there were a lot of celebrities. It was in the San Fernando Valley, and a lot of the showbiz, you know, movie people, TV people were there. And one night, this is within months of leaving Vietnam, I was found myself serving cocktails to the patients who were going to have surgery the next day. You know, you used to go in the day before. And I thought, no, I'm done. This is it. I can't do this anymore. So then I got a teaching job, and my clinical area was a VA hospital. And I was happy. I was at home. I was taking care of it. In fact, I even bumped into a couple of guys that I had taken care of when I was in the Navy. And that was thrilling. So that was, for me, that was a really good transition job. In those days too, women had to make a choice. You couldn't stay in if you wanted to have a family. You could be married, and they really didn't like that very much. Tended to be kind of punitive. But you could not have children. And so that's a decision point. And of course now it's different. A lot of these nurses that served there, they couldn't stay at the bedside, but they stayed in the profession by getting advanced degrees and playing other roles in nursing. There have been some studies done, and there was pretty high incidence of substance abuse problems in nurses that served there. PTSD. I had a good friend. She was an Army nurse. And she, you know, 20 years later, she was learning to start IVs, and they just use an arm, like a prosthetic arm. There's no other part of it. And that just triggered something in her. And she had a horrible reaction, a lot of panic attack, anxiety. So she went to the VA, and they put her in a group with guys, all guys that had PTSD. And the fellows told her, you don't belong here. You cannot possibly have PTSD. And that's commonly thought. And I like to share this quote of Colin Powell. He spoke at the dedication of the Women's Memorial, and he said, I didn't realize, although I should have, what a burden you carried. I didn't realize how much your sacrifice equaled and even exceeded that of the men. I realized for the first time that for male soldiers, the war came in intermittent flashes of terror, occasional death, moments of pain. But for the nurses in particular, the terror, the death, and the pain were unrelenting, a constant, terrible weight. Sorry, I get emotional about that. One of the things that we were taught, you can't show your emotions when you're in the situation. You can't cry, and you wait until later. I was sharing with one of my fellow volunteers today, I said, I never liked that movie, Pearl Harbor, because it depicted the nurses as panicking and wearing red nail polish. And I said, no, you're trained not to do that. So why would a nurse have it? Lack of support. Most of them hid their service, cared for soldiers who normally would never have survived, but because of the helicopters, they were in much worse condition. They would have died on the battlefield before. Wounds were more traumatic. Soldiers were young. The average age was 19. In World War II, it was 26. And I think I was 24. So they were like they were kids to me. And men saw the nurses as healers, strong, able to cope. And then a lot of it was, too, that we thought it could be bad for us, but it's always worse for them. The soldiers are in worse shape, more danger, and so forth. A lot of good things came out after every war. Medical care advances. Almost every hospital now has a helicopter because they found out about that golden hour. We had frozen blood on the ship. It was, fortunately, we had the ability to freeze, and that blood lasts a lot longer, and you use a lot of blood, and it was not uncommon to call on the crew to donate blood because we needed it, but we still had the frozen blood. A lot of techniques that are learned that are used by first responders now about creating surgical airways, reinflating the lungs, burn care advanced. PTSD was finally recognized as a diagnosis. It used to be called battle fatigue in World War II. World War I, it was called cold heart. Interesting way of looking at that. And a lot of former medics and corpsmen entered the nursing profession. And that has helped elevate the nursing profession in terms of pay, and having more men in the profession has really made a big difference. And what I thought was so interesting too was now you've probably all had a PA take care of you, and a lot of times never see a physician. And so the first PA program was started at Duke University, specifically for corpsmen and medics who'd served in Vietnam. And so the very first class, the first PA class, had 4 former corpsmen and medics in it. This is like doing a dance. So one of the things that we learned, I had the chance to go back to the dedication of the Women's Memorial. And most of these nurses, when the statue is being taken across the country on a trailer, and a lot of women came out, saw this, and they revealed for the first time to their families that they'd ever served there. So this had been, it was easy to hide, it had been hidden for years and years and years, and then this memorial was created. And when Diane Carlson Evans was an Army nurse who served there, and she has a wonderful book out too. But she was the one that spearheaded this effort. She had to fight with the Congress, first of all. And she said, is it not preeminent historical and lasting significance to the nation that women of the Vietnam War saved thousands of lives? Because they considered the women a special interest group. And they said, next thing you know, the dogs are going to want a memorial. This was in the newspapers. And on Veterans Day in 1993, when the statue was dedicated, there were over 250,000 veterans in town, and it was just amazing. I saw one of the gals that I served with, and she became the first Rear Admiral, woman Rear Admiral in the U.S. Navy. So, Frances Buckley. So this is the statue, and it had a very healing effect on all of us, just like the wall has a healing effect, and that's why we're so excited about bringing the wall that heals here to Meridian, June 29th through July 2nd. And we have a website, and we would love it if you want to volunteer or just show up. The website is The Wall That Heals, Meridian2023.org. It's kind of a mouthful, but you will remember that. And I have some brochures here to share with all of you. And I think you'll find, if you haven't been to the wall in Washington, D.C., I think you'll find it's a very place of healing. And you can do name rubbings and all of that on this wall. So, without further ado, thank you. Thank you.
Thank you so much, and I don't know if you have 10 of these or not from us, but there's another one for being here today. Thank you so much. We appreciate it.